At Emend Healthcare, maintaining a secure recovery environment requires us to keep prohibited items like drugs, alcohol, and weapons out of the facility. But how we conduct those searches is just as important as what we find. Our primary responsibility is to protect the dignity and personal rights of every client we serve. Think of a non-invasive search as balancing on two parallel rails. On one side, we have client safety. On the other, client rights. You never choose one over the other. You have to hold both at the exact same time. To move forward successfully, you need to know exactly how to manage both. By the end of this training, you will know how to perform a completely safe, compliant search, how to properly handle any contraband you discover, and how to navigate client distress without escalating the situation. Mastering this balance prevents dangerous incidents while maintaining the foundational trust necessary for a client's recovery. To build that trust, we have to start by clarifying our role. We are healthcare professionals, not law enforcement. Our searches are clinical, policy-driven safety measures. Because of that clinical role, there are absolute physical boundaries we never cross. As you can see on this diagram, you may never touch a client's genitals, buttocks, breasts, or inner thighs. Furthermore, strip searches and body cavity searches are strictly prohibited. There are situational boundaries too. You may never conduct a search as a form of punishment. You may never search a client in front of their peers. Privacy is mandatory. And you may never perform a pat-down on a client of the opposite sex. Clients also have the right to refuse a search. If they do, you may never use physical force, coercion, or threats to compel them to comply. These limits are non-negotiable. Violating any of these boundaries is a direct violation of client rights, and it immediately fractures the therapeutic environment we work so hard to maintain. When a physical search is required, you must set the environment up correctly. Move to a private room, ensure the staff member conducting the search is the same sex as the client, and bring in a second staff member to act as a witness. Before you touch the client, communicate. Explain the entire process clearly so there are no surprises, and secure their explicit verbal consent to begin. Next, ask the client to prepare for the search by emptying their own pockets and removing any bulky outer layers, like jackets or hats, which you can inspect separately. Now begin the pat-down using the standard open palms technique shown here. Keep your hands flat against the outside of the client's clothing. Grabbing, gripping, or squeezing the fabric is strictly prohibited. Follow this exact sequence. Start at the shoulders, move down the arms, and check the torso. When you reach the waistband, switch to the back of your hand to protect sensitive areas, then finish by checking the outer legs down to the ankles. For transgender or non-binary clients, simply ask whether they prefer a male or female staff member to conduct the search, respect their choice, and document it. Following this specific sequence allows you to effectively detect concealed items while keeping the process entirely non-invasive and respectful. When checking belongings, the client must always be present. As you can see, the procedure requires the client to unzip and empty their own bags, placing the items on a table. Your job is to visually inspect those items as the client handles them. Maintain a hands-off approach and avoid aggressively rummaging through their personal property. Room searches require a similar level of care, but with one key difference. 2 staff members must always be present to conduct the search together, ensuring accountability. While searching a room, you are looking exclusively for physical hazards and contraband. You must not read personal journals, letters, or legal documents. By letting clients manage their own belongings and respecting their private writings, you foster cooperation and minimize any feelings of violation. Let's apply these steps to 3 common scenarios. First, imagine you discover a suspected illegal drug hidden inside a client's bag during an admission inspection. Do not test, smell, or handle the substance barehanded. Immediately secure it in a locked area, label it with the date and client information, and notify your supervisor so they can manage law enforcement reporting. In our second scenario, you are conducting a routine pat-down when the client exhibits visible distress, pulling away and crying. Stop the search entirely. Step back immediately, give them space, and offer calm, verbal reassurance that they are safe and you will not touch them. Once they are calm, offer alternatives. You can ask them to empty their own pockets or you can use a no-contact handheld metal detector wand to complete the safety check. Finally, consider a scenario where you are conducting a room check and find a dangerous sharp, like a razor blade, hidden under a mattress. Protect yourself first by putting on gloves, secure the item safely, check the immediate area for more hazards, and call the clinical team right away. A hidden sharp is a clinical emergency that requires an immediate safety reassessment. If a client outright refuses a search in any of these scenarios, do not force it. Validate their right to refuse, secure their uninspected belongings out of their reach, and notify the clinical team to address the refusal therapeutically. Treating these disruptions and discoveries with a calm, protocol-driven response, rather than a punitive one, keeps the situation from escalating and maintains the safety of the entire facility. Balancing safety and rights comes down to clear communication, securing verbal consent, and relying on open palm, non-invasive techniques. This checklist shows the final, critical step of any search: documentation. You must accurately record the date and time, the search type, whether consent was given, exactly what findings were made, and any notifications sent to supervisors or the clinical team. Completing these steps ensures that MND Healthcare remains a secure environment where every individual is treated with dignity and everyone can stay focused on recovery.